Sipping on my sip. Olivia, we're ready. Sorry if that wasn't clear.
I will hit
So,
record.
we're all set?
Yes.
Okay. Well, our apologies to those trying to watch by the Facebook live stream. It's frustrating. The technology goes in and out of working. Thank you to those of you who've joined us through Zoom. It is Wednesday, the 29th of April, and this is the COVID-19 report for today. We are halfway through another week here, and the governor gave a briefing earlier in the day, which focused on the fact that we've just had our first day with no new infections in the state. This is very good news. It tracks with the data that we have been seeing for some time now, and I think Olivia's going to pull up a slide that shows this Chittenden County data over time. And what this says to me is we're getting to an important stage in this epidemic, and we're getting towards the point where we really can start to think about reopening significant sectors of our economy. We've talked on this briefing a number of times that really you need two conditions to be met before you can have broad reopening. One is, and when I say this, I'm sort of channeling a real consensus that's emerged among public health experts over the last month or so. What those experts are looking for is two things. One, declining and very low infection levels for a 2-week period. And when I look at this graph, it looks to me, you can debate over when you should start the counting on 2 weeks, but it looks to me somewhere around, certainly by the 15th of the month, if not a little bit sooner than that, we are really down at very low levels of new infections here in Chittenden County. And we're coming up on the 2-week mark, or essentially at the 2-week mark since then. The other thing that you need is, and this is why we've talked also with Dr. Leffler and others on how why it's so important that we use this time well, is we also need the public health infrastructure in place to support a virus suppression strategy once we reopen. What do I mean by that? Again, people have seen a bunch of these briefings, I think have some sense for it, but when we come out of this stay-home period, the virus, nothing really will have changed yet in terms of having a vaccine or having broadly effective therapies, medical therapies. So when we first come out, we're still going to be in a situation where most people have not had the virus yet. Most people do not have any immunity to the virus. And so there's a really significant chance of new infections and rapid expansion of new infections. This time, though, unlike back in the beginning of February, around the beginning of February when this the virus first got to the area, we now have significant new public health infrastructure in place. We have testing capacity that the governor spoke to earlier that was, we didn't have anything like that for the early weeks of this epidemic. Now we do. We've heard Dr. Leffler speak to that in past weeks. He's going to be on Friday to speak to that again. But getting to the point where there's really very significant additional testing capacity and much better capacity here than some of our other states, interestingly. And I think UVMC and the state working together have done a great job on the testing front. We also need this ability when someone is found to test positive. We need to be able to do contact tracing. And this is a function that I believe the governor's press conference spoke to as well today. And there's been recent discussion of it in recent days as well. The Department of Health has this significant capacity in place now and expandable if needed to really follow up on any new infection and try to figure out who else might be at risk as a result of the history of that person and the days leading up to the positive test. Those two strategies have gotten a lot of focus locally, nationally, and my sense is I'm pretty hopeful we're in decent shape there. There's a third area that has had less discussion, and we wanted to focus some of today's briefing on it, and that is this strategy of having isolation sites, of having places when people do test positive, and people are going to continue to test positive when we reopen, almost certainly. The virus hasn't gone away. Right now, and in America in general, throughout this pandemic, if someone is not yet in need or is never in need during their illness, as the majority of cases are, of needing hospitalization, and a large majority of cases, there's some debate over it. Maybe we're still trying to understand how many people. There's still a lot of research and study going on to try to determine what percentage of people who become infected end up needing hospitalization and ended up needing ventilators, the ICUs. That's all still being debated and studied, but whatever, it may turn out there's even a lower percentage than previously thought that need that level of medical care. However, it's very clear most people do not need a hospitalization. So the strategy for those people when they test positive up until now has been almost universally in America, has been for people to be told to go back to their homes and to try to isolate themselves within their homes. And that strategy really stands in pretty significant contrast to the strategies that have been used in Asian countries. And we thought we'd talk about that a little bit more today. And one of the reasons we want to talk about it is because we want to make sure everybody knows that here in Chittenden County, people have a different option. There is and has been for several weeks now a COVID-19 recovery center out at the Holiday Inn site just east of the highway, just east of 89. And that site now has been operating, and we have Brian Pine, who is a city councilor in Burlington. And I guess we'll go to Brian in a moment. So let me we got this slide up here. I'll speak to this, and then we're going to bring Brian in. The site that we have there out at the Holiday Inn now is a place that anybody who tests positive can go to if they don't feel they can safely or properly isolate at home, or they're concerned for any reason about isolating at home. And this is a quote from a New York Times article that was a little over a week ago that really focused on this question of these isolating people who are ill. And the article focused in on how very frequently it's not successful when people try to wall themselves off from their families in their own household. Frequently, you see the spread of the virus within that household. And one famous example of that was with Chris Cuomo, the brother of the governor and CNN reporter who was isolating in his basement. And a couple of weeks ago, it was revealed that even having that kind of generous amount of space, his wife ended up becoming infected. And there's increasingly focus on this challenge with home isolation. And I think that challenge is going to be even more significant as we move into this reopening period and we're relying on these suppression strategies. We got to be even more concerned about that transmission within the home because it could lead to the spread of the virus in this reopening stage. And they did have this expert quoted in the article there at the bottom that this is really one of the this doctor, I'm not sure there's broad consensus on this being the one intervention that everyone would choose, but it's clearly one of the major interventions, one of the major strategies for this suppression period that's coming up on us. And we have built the capacity here with the partnership of the state, really the leadership of the state and CVOEO, our local economic opportunity nonprofit. We have a place that people can go to other than their home when they test positive. And we have with us Brian Pine, who is one of the site managers, co-site manager, and also, again, a city councilor here in Burlington. And Brian's joined us to give us an update on how things are going at the COVID-19 Recovery Center. And we can talk a little bit more about this strategy. Brian, welcome. I think we have Brian. There he is.
There we are. Great. Thanks. It's good to be with you. How would you like me to, just to describe what we've created here at the Holiday Inn?
Yeah, I think that'd be great. I think if you could paint a picture for what the experience is like over there and what kind of support people get if they choose to isolate there. Any other observations you have about the first weeks of this this new facility?
Yeah, sure. The Champlain Valley Office of Economic Opportunity was asked by the state of Vermont Agency of Human Services as part of the state's emergency response to COVID-19 to create a facility to handle potentially up to 200 individuals and or families who are COVID positive. The initial goal was to ensure that people who are homeless or who lack a safe place to isolate and recover would have this resource available to them, both for their recovery and to isolate them from further spread of the virus. So that was the initial goal of creating this resource. I was hired as part of a team. I am joined by Liz Curry, who is the co-manager. She is really the operations manager, and I am the site manager. So we sort of have divided our responsibilities accordingly. But essentially on the 13th of April, the Holiday Inn closed their operations. Their staff left. They packed up everything they could. They left the property, and that night we had our first guest arrive. And we have hosted only a handful of guests in the 2 weeks that we've been in operation. Really what we have is a fully staffed facility with the ability to house up to 150 individuals and families if necessary, that has been fully staffed. We provide, the meals are delivered to the rooms. The staff are wearing full PPE, those staff that are in potential contact with what we call guests here. The rest of us are working in offices that are, we break them down into three categories of cold being really minimal chance of any viral load being present, a warm zone in the hotel that is an area where workers who may be exposed to the virus through their coveralls, their protective coverings. They will be they can enter those spaces, and then the hot zone, which is the area where the guests reside, and all of these zones are actually protected from one another. So we've created actual physical barriers to prevent the spread of the virus within the building in that way. We've also attended to things like ensuring that the HVAC system is tuned just right, and all the fans are pulling exhaust air through the bathrooms of every guest room, so that the virus does not move from room out into the hallway and then begin to migrate elsewhere, so that staff are exposed to as little risk as possible. For the guests, all I have to say is the people who have stayed here have really appreciated it. It's a very lonely experience. It's a very isolating, literally isolating experience to be essentially sent off to heal and recover. But we're here to ensure that that process is as that it's as positive an experience as it can possibly be, given the difficulty of the circumstances.
Well, and Brian, it sounds like you guys are having success at making it a positive experience. We do have up on the screen right now, I'm not sure if you can see it, but the 7 days quote of one of the guests that stayed with you. And I think, I want to stress that this is someone as a Burlingtonian, someone who just, was living not in some, I think sometimes people have thought of the Holiday Inn site as being just focused on homeless individuals or people living in a congregate care facility. But what's important, and a message that we really want to make sure is getting out there as we are moving forward from here, is that this is a facility that's open to everyone. And here's what this individual, Chris, reported, that the hotel lunches were actually quite good. And I think the voice of the reporter, it was quiet there too. He didn't see any other patients. He only heard workers softly padding down the hallway, making their rounds. Chris was grateful that doctors referred him to quarantine and rest there. And that last sentence, I think, is really the one that I hope is widely understood, that it isn't just Chris's doctors that understand this opportunity, because our system really requires the numerous primary care physicians that are operating in Chittenden County. They need to, as they are talking with a COVID positive patient, be fully aware of the opportunity at the Holiday Inn site, how it really can be a positive, supportive experience for a whole range of patients. And the public needs to be aware of this, because the system is, we're not China. We're never going to be China, where the government was ordering people to go to sites. And I think these isolation sites maybe got a little bit of a bad name because of that kind of authoritarian image that was coming out of China, and these huge gymnasiums filled with people in cots. And I think that may have been an early image of isolation sites that people got into their head. The Chittenden County version of that, people should understand, is a nice hotel with hotel amenities and with good food and Wi-Fi, Brian, right, and access to good video services. I mean, it's what you would expect in a hotel setting, right?
Yeah, that's right. The only things that are no longer available would be the gym, the sauna, the pool, things like that are not available. But other than that, it's a typical hotel experience in every other way. We don't have a kitchen that's functioning here. Well, the kitchen would function, but because we have a small number of guests, we've chosen to just purchase meals at local establishments as needed. So we're on an as needed basis to purchasing food, but we deliver the food to their door.
Excellent. So, again, one thing about responding to this emergency, April 13th, you point out the first day there, that date is basically the date we were just pointing to on the slides, where this facility was just opened as the new infections were going down quite precipitously in Chittenden County. So what I think we should be thinking about your site, Brian, or if not your site exactly, it's got to be a resource like it for the period ahead, this suppression period. I don't, just as you said, there's only been a small number of guests that have stayed there so far. I think that really, and that's been consistent with the experience. My understanding is of a few other parts of the country that have a facility like this. There's the Seattle, King County area has a facility. And I think some people have looked at that data and said there haven't been that many guests so far and questioned the strategy. What I think we have to have some public discussion about, and why we're talking about here today is, what is the right strategy for this upcoming period, which is going to be very different than the stay home period. It's going to be, our goals are going to be very different. Our goals in the upcoming period are going to be reopening the economy, turning society back on, getting people back to work, getting kids back, eventually into children's programming and hopefully schools by the fall. And so there will be new infections in that period. And again, I think this kind of facility to minimize the impact of any one infection and to give people proper health supports while they are battling the virus are going to be more critical in the coming period than they have been in these opening weeks when we're telling everybody to stay home, and that's our main strategy for keeping the virus from spreading. So
I would just add one thing here is that under the stay-at-home order, and this is true both locally and nationwide, the assumption was among the medical experts was that if a family member was to get the virus and they were all staying in the same quarters, it would spread there, and that's not necessarily that's a negative outcome. However, if we no longer have a stay-at-home order, people continue to contract the virus, but it'll spread much further into the general population because of the no longer are we staying home. So there's that added risk of the reopening leads to a further spread that is in many ways hard to measure and hard to predict, but the medical community has clearly identified that reopening too fast and in too broad a way is likely to result in very negative health outcomes. And so I just want to reiterate that we're not a medical facility, but we provide telemedicine to every resident if they don't already have that relationship with their provider. And in all cases, they've come with that relationship. We've ensured that people continue to get regular telehealth to meet their health needs, and there's frequent monitoring of their temperature and their conditions, so that after a fixed procedure and protocols are followed, if the outcome is that being here for 5 days or 6 days, or in one case someone was here for 8 days, that they are no longer COVID positive, that's when the discharge process takes place. But that from the time they arrive to the time they leave, they're getting all the health support they need to fully recover and to get back to life, normal life.
Yeah, Brian, well said. I think you said what I was trying to say much better. And just to expand on it even further, and to kind of take that example we had of Chris Cuomo earlier, when we're in this stay home posture, it's an unfortunate event for Chris Cuomo's spouse that she becomes ill when she's in the same household as her husband, but the impacts of that are probably limited to that household. If we are out of the stay home posture, there could well have been a period where she didn't know yet that she was positive and was circulating outside the house, and there's the real possibility, and a heightened possibility in this new period we're headed into of transmission than there is during the stay home posture. So that's exactly why, my sense is this strategy, which has sort of been underutilized in America up until now, is going to be more important for the period ahead. Let's just keep talking a moment longer, Brian, if you have another minute, just about this phase 2 that, I'm voicing real hope is getting close. I think I've been a very strong advocate for the social distancing measures. Up until now, I have supported every step of the way the governor tightening the stay home order. And, in fact, here in Burlington, I think we had, with the closing of the bars on St. Patrick's Day, that was one of the most earliest and most significant steps in that direction. I want to be clear now that I think the governor's doing the right thing in starting to loosen up, and I really think we're getting to the stage where we can need to be really looking to take loosening steps in the coming days, and looking to restart the economy, which we know is hurting so badly and has very significant long-term consequences if we can't get it restarted soon. I want to be clear that as we talked about these public health strategies, these suppression strategies, I think sometimes some people may hear that as these are further problems for the economy going forward, that we're going to have these testing, tracing, isolation strategies. And I really hope that people come to see these strategies as actually, they are public health strategies for sure. These are strategies to limit the expansion of the virus and save lives, but they are also strategies that if we succeed at them, if we're good at them, that will create the extended period here, or maybe a permanent period, where the levels of virus transmission in the community remain at very low levels, where we can, it is these public health suppression techniques, strategies, efforts, this infrastructure that will actually be what allows the economy to return quickly, reopen, and stay open in the months ahead. So do you, I don't know, Brian, if you, I don't even put you on the spot on that, but do you have it, I'm curious your reaction to that framework.
Well, yeah, because we have, a real limitation as far as how employers can continue to keep people on the payroll and offer paid sick time. And there's a limit to what folks can do. So if we can adequately ensure that those who have the virus are isolated from spreading the virus to their family and their coworkers, I think it's reasonable that is essential. That's an essential part of the strategy for economic recovery, is to ensure that those who go to work can go to work knowing that their coworkers aren't bringing the virus to work with them and risking the fellow employees, which would be disastrous, as well as interaction with members of the public through their customer base. So I think that's really critical. Yeah.
I mean, that's another, I think we haven't quite made that point too. And maybe to close out this topic, again, I raise this just because I think somehow a lot of people have had this, these isolation sites have had this negative tinge to them coming out of the early reports out of China. When I think about, if my spouse, if Stacy were to get sick when we're in this reopen period, the idea that you, Brian, the Holiday Inn site is there and a place that she could go to, both not just to help me avoid getting sick, but also you would ensure that she is getting a high quality of support through this challenging period, and that there would not be I just think it'd be something that I would see as a service, as a real positive, knowing that she could go there and it wouldn't be put on me as the spouse to have to try to navigate this challenge of trying to stay healthy while supporting a spouse and hold down a job. I actually think this is, in that sense too, this would allow other people in the household to go back to work or back to school, even as one member of the household is suffering. So thank you, Brian. I guess is fundamentally, I don't want to close without saying that it's I know this is an area you really is a lot of you is different than some of your prior professional experiences here in the city and working in the in the efficiency field, but it's pretty remarkable how you and your team got this operation set up and open. I think, and I know it's no small amount of courage on your part to put yourself in an environment where you are taking greater risks. So thank you for doing what you're doing.
You're welcome. It's an honor to be able to serve this community, this state that way.
Awesome. All right. Well, thank you for joining us, Brian. We're going to go on to a couple other quick topics. Olivia, if you could take us on to the next slide. We have a weekly update from the COVID-19 Resource and Recovery Center. Different, there's some confusion about titles here. This is the Burlington RRC, Resource and Recovery Center. This is the virtual center that has about 40 city employees that spend some part of their time responding to inquiries from the public. We've had 77 inquiries over the last week, and 10, during and that is on top of about 700 in the weeks before that, leading up to now. We like to show these graphics, which you can also see on our dashboard. And that initial graphic that we opened the presentation on is also on the city's dashboard. So again, want to make sure everyone knows that is a resource there. If you're trying to track and stay abreast of what is going on here in Chittenden County, it is a really good resource for being able to see that and seeing, again, this certainly currently low levels of infections. You'll be able to track that over time on that dashboard, and other things such as why are people reaching out to the recovery center. You can see here over the last week, we've had continued to have people reaching out about unemployment insurance and labor needs. The mask making effort and people calling for masks continues to be an item that we are hearing a lot from. People are starting to talk about the tax deferment program. And let me just mention there the plan. And I think Luke McGowan, one of our directors of the RRC, is with us, and I'm going to turn it over to him in a moment. I do just want to give people an update that we will have materials on the RRC site and on the city's homepage about what you need to do to postpone your taxes, your June 12th taxes, without interest or penalty. We will have that posted by May 12th. We are holding off on posting that now as we finalize details about what this program is going to look like, and frankly, as we look at whether there's going to be some expansion beyond just that 2-month postponement that we're able to offer. We're thinking it's likely we'll be speaking with the city council about this on May 11th. So for anyone listening that is wondering why there isn't more information up yet, that's the answer. Check back on May 12th, and a full month before the payment is due, and there will be more details. Luke, are you in fact out there in the ether?
I'm out here. Can you hear me?
I see you and hear you. Yes, welcome. What else can you tell us about the current state of the RRC?
Yeah, so I think you summarized it well. We continue to see about 20 inquiries a day coming in. It really depends on the day, on what issue comes in. We have seen a general trend towards more unemployment calls, people asking for help navigating their unemployment, what forms they should fill out, when can they expect their checks. And we've actually streamlined some of our contact with the Department of Labor to help get sort of the Burlingtonians' questions that they're asking answered as quickly as possible. So that's been some progress. We also recently moved from, we had a total of 41 people. We're now at 38 at last count, 38 city staff working at the RRC. We moved from our great BED call team to another team now made up of a person from the Permitting Inspections Office and someone within CEDO to sort of be that frontline call that you reach when you call that number on your screen there. And that was partly because BD is starting to see their busy season. And also we're always thinking about how to make this more sustainable going forward. The last update, we see our primary goal as sort of answering questions whenever they come, whether that's by email or phone. But we also want to scale up that type of activity. So when we answer questions, we want to get that information out to as many people as possible. So we've been hosting a webinar series once a week. Last week, we had an economic impact stimulus payment webinar. Coming up, our next webinar, May 6th, is going to be on the sort of sustainability aspects. So helping especially commercial tenants and landlords understand how they can both save energy and save money while their businesses are shut down. And we have a sort of full series planned out, which you can see on the RRC webpage. We'll have a schedule and importantly, recordings of the webinars that we've hosted. So if you have questions, I recommend going to the website to get them answered there. So I think that's what I got, and I'll turn it back over to you, Mayor.
Great. Well, thanks for all that, Luke. And yeah, I really think your team has done a great job with the website. And it does, I don't know if we have that data up on the dashboard or not. If we don't, maybe it'd be a good thing to put up there. In addition to these calls, it's clear that the resources that the RRC has been marshaling and the additional guidance and refinement that you've been able to kind of essentially publish there is there's about 100 visits a day from Burlingtonians, or we don't know exactly, it may not be the Burlingtonians, but from visitors going to those resources on the website as well. So great job with that. Again, if we didn't hit it enough, those contact numbers are there on the screen for people who do need one-on-one help, one-on-one consultations. Give that number a call, send a note to that email address. The goal of the RRC is to respond within 24 hours. We want to hear from you if you are having some kind of challenge in this crisis, whether it's accessing the federal benefits that you are owed, or there's some kind of direct problem that you're dealing with, that there's no other part of the safety net to help Burlington. I've set this up to fill in the gaps during this unprecedented crisis. We want to hear from you. Be in touch. Okay. I think we did just want to do a brief update about the Community Mask Initiative, and wanted to make sure that anyone watching was clear that we are now well into the phase where we are beyond simply trying to provide these high quality masks fabricated in this partnership between the city of Burlington and community individual sewers, as well as some businesses that have that capacity, like Vermont Teddy Bear. We have more or less, we think, responded to all of the requests from emergency essential workers here in Burlington. And we have also distributed these masks. So that was the first push, was to get these masks to essential workers that needed them. We've very much started the effort to get these masks to vulnerable populations, and we are working with some of the housing providers that work with older facilities, older individuals, live-in facilities that are for the elderly and for medically fragile communities. And one of the ways that we're also trying to reach these medically vulnerable communities is through a distribution during these high-risk shopping hours that various grocery stores are having. And the next chance for people to get their groceries and get a mask at the same time is tomorrow, Thursday, April 30th, from 7 to 8 a.m. out at the Hannafords in the New North End. You'll have masks there. They are free. Come pick one up. Come pick up more than one if you're picking one up for someone else in your household or a friend that needs them. We will keep publishing information on how people get more of these as they are produced. We're up to over 11,000 masks now have been distributed, and the plan is to keep going, and as long as there is a need that we can meet. So, and yes, so that's more opportunities to be announced next week. There is the address to follow if you want to check the website for your stuff. And finally, we always like to close these briefings with a fun at home resource of the day. The city team continues to work hard to make new original content available online, virtually for Burlingtonians and really anyone to enjoy. And the resource we're focusing on today is I Spy in Burlington worksheets, which are being published by the Parks, Recreation, and Waterfront Department, and you can find them right there on the Facebook page. You can see on your screen, BTV Parks Facebook page. It is the latest in a series of virtual recreation offerings, and I can tell you, I have spied a bunch of those red cardinals this spring. I feel like more than normal, and some bluebirds. So I think that's an achievable. I've seen 3 of the 4 there, Olivia. How about you?
Same here. I've not seen any woodpeckers, unfortunately.
I saw a woodpecker on the corner of College. I saw 2 woodpeckers recently. I've never seen a woodpecker in Burlington before.
Wow. So the mayor's office has completed the page. We're ready for another one, Parks. With that, Olivia, are there any questions online?
Yes, there are. And reminder for members of the media who are tuning in, if you have questions, please submit them by emailing them to me. We have some questions so far from Aiden Quigley at VT Digger. Aiden's first question is, what is your reaction to UVM's announcement that they are planning to be open for in-person classes this fall?
Well, I support that decision at this point. Aiden, I am hopeful that we will have the infrastructure that we've been talking about earlier in today's briefing in place and getting more and more robust as the months come, and that we will be able to support in this community a successful suppression strategy that makes it possible for us to, if not fully go back to normal, at least reactivate many elements of our economy and our way of life. And one of those is having students go to classes in person. I think UVM made the right call. I think it was a really important call. It may have helped Vermont maybe more than any other decision, and ensured some of the very positive early returns that President Garamella told UVM students who are off on spring break that they did not need to come back. They should not come back for classes in the spring. I think that was the right call at that time. And I think it is the right call to be hopeful that we will be able to have in-person classes this fall. And I'm hopeful we're going to have in-person K through 12 education as well. We will have to, I think that's the right posture for now. It's the right goal to be working towards. None of us know what the future holds. I do think I have real concerns about there being future spikes in infections that require future social distancing orders. But I think certainly our goal should be to restart the economy and keep virus infections at a low level through these various strategies. And I think that's consistent with the UVM opening in the fall.
Another question from Aiden. Are you concerned about the possibility of a large number of students and parents coming to the city from out of state to move UVM students in and out of off-campus apartments at the end of May? Do you think that can be done safely amid the pandemic?
The end of May, I do think is a challenge, is a different challenge than the fall. I understood your question. I just want to make sure I was answering your first question about the fall is how I understood it.
Yes, that is how I am reading these questions also.
The end of May, June is a different story. I think, listen, there are still significant hotspots, even though this virus outbreak is quite suppressed right now in Chittenden County, as you can see from the data. And even though it's on the definitely a steep decline in the Boston and New York metro areas, there are clearly still significant numbers of new infections happening every day in those other localities. My understanding is that the governor's order on quarantine for entries into the state remains in effect, and as long as that quarantine order is in effect, it needs to be observed, and anyone who is coming for a move in, move out needs to respect that and work with that. And that adds significant complication to that process, and people are going to need to take that into account.
Last one from Aiden. Is there anything the city is planning to do to try to ensure that this process plays out safely?
Yes, I mean, we see our role as being, we are the boots on the ground in this public health emergency, and in the enforcement of the orders of the governor and my orders here in Burlington. And certainly we are watching those orders very carefully, and we are constantly advising our police officers and the parks, other city staff that are engaging with the public to do what we can to educate the public, advise the public of those orders, and stay involved. We also have been reaching out to another role we play in this, and that our RRC has played a significant role is being a kind of liaison between Burlington and the Agency of Commerce and Community Development, which is has a role in promulgating a lot of the guidance around what activities can take place and what can't. And so we have been reaching out to the state for clarification about how they expect us to handle this move in and move out, which is still, the end of May is still, seems like a long way off in the life of this pandemic. I think we should keep that in mind as we sit here at the end of April. If we're talking about events at the end of May, beginning of June, we may have very different information and a very different sense of how things are going by then. The current status is the quarantine orders for people traveling into Vermont are in effect. Burlington, to the degree we can, and there are certainly enforcement limitations and challenges here, but we are aware that that is a situation that represents the possibility of new infections, just as we are coming out of this stay-home posture, and we will definitely be paying close attention to it, monitoring it, and playing any materially helpful role we can in making sure that the orders are understood and enforced.
That looks like those are our questions from the media for today.
Great. Thank you, Aiden. Thank you, everyone, for tuning in. We are anticipating, I do expect we will have another briefing on Friday as we head into the weekend. We're working on a lot of initiatives, and we will be kind of checking in with where we stand here in Burlington going into the weekend. We'll be paying close attention to whether there's any change coming from Montpelier and the governor with the stay-home order in coming days. Come and join us on Friday as we try to apply what we know to our current condition in Burlington and the weekend ahead, and looking out beyond that. So thank you for being here with us today. We'll see you again Friday.